like to introduce myself. I'm Dr. Frank Kimsey. I'm a radiation oncologist here in Chattanooga, Tennessee, and I'm speaking to everybody today to introduce a wonderful new technology to Chattanooga, Tennessee. Erlanger Hospital has been a pioneer in this community for the past greater than a decade in stereotactic radiation treatment for brain tumors. In the past 3 months, when we were looking at upgrading our equipment, we decided on the #1 technology that we were able to find in this country, and it's called the Cyberknife. We've been utilizing Cyberknife for the past 3 months here at Erlanger. We've probably treated close to 40 patients at this point with an extremely wonderful success rate. Also by decreasing the toxicity of what we're able to do with our radiation treatments. The Cyberknife unit is basically, if you would go to the Volkswagen plant, it's an automotive welding robot. It's off-the-shelf technology. But what they've done with the technology is they have adapted a miniaturized radiation treatment unit about the size of a suitcase that's mounted on the head of the robotic unit. The key to the Cyberknife technology is we're able to pinpoint a tumor not just in the brain that we've been doing for the past decade, but we're actually able to pinpoint tumors elsewhere in the body. One of the big problems we've had with traditional cancer therapies is the toxicity to the surrounding normal tissues. A lot of our cancer therapies do cause damage to normal tissues, and one of our goals has been to reduce that damage to the normal tissues, and we think the Cyberknife has been a wonderful tool to help us segue into treating tumors in other parts of the body. The key to the technology is not necessarily the equipment, but actually the software. If you would imagine a missile being shot across Russia to the United States, we're actually able to track a tumor similar to missile tracking technology as it moves in the body. The Cyberknife is actually able to pinpoint the tumor. And as that tumor moves, if we breathe, or if the patient moves, the Cyberknife unit is actually able to track that tumor real time in the body. It's the only technology available today that's able to do that. The other key to our Cyberknife technology is that traditional radiation units rotate around a patient, so they're only able to treat a tumor in one plane. But with the Cyberknife technology, we're able to treat that tumor from an infinite number of directions from different nodes around the tumor. By being able to do that, we're actually able to decrease the damage to normal surrounding organs that we would otherwise encounter. Cyberknife unit has done some wonderful things. It has been able to treat patients in a shorter period of time, whereas a traditional course of radiation treatments may be as much as 7 or 8 weeks. We're oftentimes able to treat a tumor in as few as 1 to 5 fractions, so we're able to get the treatment done in a week or 2. So not only does it decrease the patient's time that they're undergoing our therapies, it's also able to increase the accuracy and able to decrease the collateral damage to the normal tissues. I'd like to introduce one of my patients, Mr. Hugh Gardner. Mr. Gardner was one of our wonderful first patients to allow us to treat him on the Cyberknife unit for prostate cancer. And I think he can share with us some of his experiences with the Cyberknife unit as a patient, not from just a professional standpoint of what benefits I think it's brought our patients, but from a patient perspective, and he could tell you all about it.
Thank you, Doctor. I am excited about the Cyberknife, and when I was first told that my PSA had risen and I had a problem, my doctor, Dr. Wood, sent me to a urologist, Dr. Kahn, and he checked things out and said, yep, you have cancer, and here are some options. And he gave me a book, and the book had 100 questions, and I put another 100 to it, and then started investigating what I needed to do. I had advice from all kinds of friends, a little support group at church, and some said go to Atlanta, go to Jacksonville, go to MD Anderson in Texas. And I investigated these places, made some calls, and come to find out, really and truly, the treatment is about the same. It's got to get radiation to the spot to stop it. It's just how you get there was the key. And after I looked at the Cyberknife, I sort of liked what it did. You said it was like welder out here at the Volkswagen place, but they hit the same spot every time, which humans don't quite do. And this thing is very accurate and very precise. And after the treatments, I had 5 treatments. Had an uncomfortable week following that, which Dr. Kimsey said I would have. And after that, it's fine. And after each treatment, I could go do my normal activity, which at this time was gardening and working in the yard. Even though I work, I was not employed at the time. So I'm excited about the Cyberknife, and hope that if you have an interest in it, that you investigate it as well. Because right here in Chattanooga, you can get the same thing that you could get in Atlanta, or Dallas, Fort Worth, Nashville. So why do the travel? They have it right here, and that was what really excited me. Thank you.
You guys have any questions of Mr. Gardner? He's one of the benefactors of this wonderful technology.
Mr. Gardner, are you cancer-free at this point?
As far as I know, I just had a PSA done. It's on the way down. I go back at the end of this month for a follow-up, and I expect it to go down. Tell me you can expect this to be cancer-free for 10 years, but it can always return. So as far as I'm concerned, I have no symptoms, and everything is working like they said it would work.
There you go.
So I feel good.
Talk about how grateful you are, obviously, just having more years added to your life because of this breakthrough.
Well, I don't know where it adds any more years to your life or not, but it'll make those you have much more comfortable. I mean, I had a choice not to do anything. At my age, they didn't recommend surgery, so that was not an option. So I took this one and feel good about it.
One of the large groups of patients that we've had under treatment here have actually been patients, not our typical brain tumor patient population that we've seen for the past 10 years, but they've actually been early stage lung cancer patients, and folks that their lung function is too poor from their emphysema or their COPD, or they're too old, or they have other medical conditions that don't allow surgery. And with an early stage lung cancer, we're able to apply the Cyberknife to those tumors and achieve pretty much the equivalent of the surgeons wedging that tumor out as far as control rate. And right now in our 5-year data, looking at survival, it's going to be pretty close. So we're able to offer patients that have not otherwise had a good treatment option, a very non-toxic treatment option to offer them hope in treatment of their lung cancer. We've probably treated close to 30 patients with inoperable lung cancer, and we've seen virtually no side effects. We've seen an excellent control rate. We've only been using the Cyberknife for 3 months, but it's been very encouraging, and I think our patients have been extremely grateful to have that option. One of the things to keep in mind is not every cancer patient is a candidate for this. That has to be a very specific indication, and we try to adhere to strict criteria of what patients we accept into the program, so that we're treating folks appropriately and providing care that we know is scientifically based and going to improve their outcome. Probably only 10% of cancer patients may be good patients for this technology, but those 10% of patients, it's been a wonderful alternative for them.
Just talk about how this obviously isn't available everywhere, so just in a way you can take pride in this to have it.
It's been a wonderful 5-year project to bring this technology to Chattanooga. For us to do anything as physicians that's going to improve outcome and decrease complications of treatment of our cancer patients, then it's beneficial for us, the patient, and the community.
Since you've been using it, do you know about how many different surgeries you perform with this?
There's different circumstances. We've treated brain tumor patients that we've already had an existing population, patients with benign brain tumors that are inoperable, that are causing them problems. We've treated patients where their cancer is spread to the brain and eliminated some of the need for treatment of the entire brain with the radiation treatments. We've treated early stage lung cancer patients, and we've also treated some patients that had had prior radiation therapy that may not have had another option. We had one patient that was unable to walk, that her leg was paralyzed from a recurrent tumor on her spine, and within 2 treatments she had pain relief. Within 5 treatments she was able to walk again and move her leg again. And, a year ago in this community she would either have had to have major surgery with its associated complications or no option.
Completely eliminate a lot of the side effects from traditional radiation therapy, hair falling out, nausea, sickness, etc.
A lot of what you're describing is a systemic side effect, such as nausea, vomiting, hair loss from chemotherapy. Radiation therapy has traditionally caused side effects from the normal tissues surrounding the cancer, such as problems with a sore stomach from treatment of a tumor in the upper abdomen, or problems with brain swelling with a large area of treatment. Because the Cyberknife is so focused and from so many different directions, we've been able to reduce those side effects as well as reducing potential complications, because we're treating less of what's normal surrounding the tumor with the treatment. I also like to talk about our new lung optimization treatment. We're the first center in the world that has had access to the software upgrade for the Cyberknife system that gives improved targeting on the tumors. Traditionally in this region, patients have had to have small gold seeds placed in the tumor in the lung, which is associated with complications with the needle placement, potential collapse of the lung anytime you introduce a foreign object in the body like that. With our new lung optimization treatment software that we upgraded to 2 weeks ago, we're the first site in the world that a lot of those patients are not going to have that done, that we're going to be able to track the tumor without those marker seeds. And that's another way that we're being able to improve our care and lower the complication rates.
Dr. Kimsey, you talked about this being a 5-year project. The board approved the purchase of the Cyberknife quite a while ago. Was there a delay in getting the technology where it could work? I mean, you talked about it's only been here for 3 months. Was there a delay at all, or?
It's a big deal.
Okay.
It's a big deal to accept new technology and to bring it to a program. There's also a learning curve, and much of this new technology can be costly. You have to figure out how to get it to the board to be able to make it productive for the patients and the hospital, and I think we were able to do that over that time period.
In the learning curve, was that an obstacle just as far as just basically learning how to use a new piece of technology all across the board, not just doctors?
All across the board, all across the board. I think that Mr. Brexler was the beneficiary of many letters from our prostate support group that I talked to them about 3 to 4 years ago about this Cyberknife technology, and they came to bat and wrote letters to the board and Mr. Brexler to try to get them to step up to the plate and help us bring this technology to the community, which they did. I'm very proud of them. Any other questions? Do we have an opportunity for them to see a demonstration today? That is great. All right.